Hello, everyone, and welcome back to episode 65 of Your Birth Bestie podcast. Today, I want to share all about collecting colostrum during pregnancy, how to do it, and why I think it's worth a try. I am 37 weeks pregnant this week and literally just tried this for the first time tonight and was able to express 0.4 milliliters of colostrum, which I'm definitely calling a win. This is the first time I have ever tried during any of my pregnancies to collect colostrum prenatally, and I am excited to be on this journey with you. I have recently helped several moms learn more about this, and they have had actually really great experiences and collected several syringes to be able to then bring to the hospital with them as a backup if there were, any feeding difficulties. And I am so excited to do the same for myself and to help you if you are interested as well. I also linked a few resources in the show notes below. One document has a great written instruction guide and a video as well that you can access that demonstrates what I will be talking about in this episode when I get to that step-to-step collection tips. I also linked the syringes that I purchased myself from Amazon, and then the lactation specialist, Jackie, at Latch Lake Country that I personally saw at 34 weeks to plan for my third breastfeeding journey, and who is an amazing local resource, but also does virtual consults as well for some really amazing education if you are not local to the Lake Country area. So definitely go and check out the show notes after listening to all of the details on collecting colostrum during pregnancy. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. You might have heard of colostrum referred to as liquid gold because it's the very first bit of milk produced by moms that is super high in nutrients and antibodies that play a really important part of boosting a newborn's immune system. When a baby takes in colostrum, it lines their gut and helps develop their digestive system, and again, protects against harmful infections. The natural laxative effect can help baby have their first stool, which also helps them get rid of bilirubin, which when there is too much, would put the baby at risk of having jaundice. It is really the best thing to give your baby right when they are born and gives them the healthiest start possible. So learning more about how to give this to your baby is a great first step, and I am so glad that you're here. If you have never considered colostrum harvesting prenatally or aren't completely sure you want to try, I want to share with you some of the benefits and why you should maybe think about it. And the first reason is the most obvious, and that is if you are already noticing leaking from your breast during pregnancy, instead of letting those drops go to waste, you can collect them. There is something called the Elvie catch that my lactation consultant recommended me trying, and I plan to use in those first few months of nursing and, while my milk supply is regulating, but it can also be a really good option during pregnancy. I used the Haka ladybugs with my second baby, but apparently these Elvie ones are much flatter and discreet in your bra, and they don't create any uncomfortable suction like I noticed with the ladybugs. So it might be worth a try if you are interested. It is basically a discreet and comfortable way to collect milk and build up a small supply of colostrum that can be helpful once your baby is born if you are already leaking during your pregnancy. Not everybody leaks during pregnancy, and it's actually probably more uncommon than not. So if you are not leaking, it doesn't mean that there isn't milk there that's being produced and you won't have an adequate supply. It just means that you're not leaking yet, which is totally a possibility, and either way is completely okay. Another reason to consider colostrum harvesting prenatally is that more commonly there are challenges that can make breastfeeding difficult at first. Some babies might have trouble latching due to coordination. They might have a lip or a tongue tie. They might just be really sleepy, or something else might be going on. Other babies might have to spend some time in the NICU or have some health issues that cause mom and baby to be separated. In these cases, it can be super nice to have some colostrum already stored up, and then it can be fed to baby so they can receive those benefits that we talked about before of that first nutrient-rich milk, even if direct breastfeeding isn't completely possible right away. I recently had a mom that was absolutely exhausted after her labor, that she wanted a bit of time before she tried to latch her baby for that very first time. And dad was then able to feed the baby the colostrum in the syringe that she had collected in the weeks prior. And it worked out really well for mom to get a moment to rest. And then dad had that skin to skin bonding experience as well, which was so special to witness, gave mom a break. And then she did put baby to breast as soon as she was ready. Collecting colostrum can also help moms more than, just that nutritional aspect of knowing that their baby is getting those antibodies and helping their immune system. But it can also just mentally help them know that your baby has a backup supply of colostrum before they are even born. And that can help moms reduce their stress and their anxiety about, a potential breastfeeding difficulty, whether it's your first baby and there's that really huge learning curve, but there's also a learning curve with each baby, no matter how many babies that you've had. So you never know how those initial first few feeds are going to go. So having those, syringes of colostrum just as a backup can really be something that moms find reduces their anxiety. I know for me, this is a huge reason why I want to try this time around, because my other breastfeeding journeys were really, really difficult. I also have large babies that may be at a higher risk of having some blood sugar instability. So that adequate intake is monitored more carefully, the weight gain, so their blood sugar is more stabilized. And it would be great to know that I have a small amount to give my baby if needed during those first few days, instead of supplementing with formula or donor milk if necessary. This really helps moms to feel prepared and proactive in their baby's care, and then also create a sense of empowerment and readiness for any of those challenges that might come up, because so much of it is really unpredictable. And then there are also certain situations where colostrum harvesting can be particularly helpful when you have a pre-existing condition like diabetes, for example. Babies born to moms with diabetes can be at a higher risk for blood sugar instability, kind of like I talked about, and then having colostrum on hand can help those babies manage their blood sugars more effectively. Same with babies born with low or high birth weights, and this would be, less than the 10th percentile or greater than the 90th percentile for reference. But these babies are, also at risk for blood sugar instability. And I have seen many parents pressured into supplementing with formula much more aggressively because their baby is in either of these categories than a baby without any concerns otherwise. Also, for moms having multiple babies and want to stimulate milk production for both babies, or are having a planned C-section where it might take a little bit longer for milk to come in, as there is that little bit of a delay of hormones to be signaled to produce milk. So having colostrum there as a backup can be helpful as well. So really, collecting colostrum prenatally is a practical and beneficial way that can support both moms and babies through some possible early challenges, whether that's dealing with a pre-existing condition, anticipating complications, or simply just wanting to be prepared and have that as an option because you can. I think that having a supply of colostrum ready and just a few syringes full is what I mean by a supply, can make a significant difference in that postnatal period. We don't need ounces and ounces of milk, but just the littlest amount, collecting those small drops can really make the difference for those first few feeds. So now let's talk about actually getting started collecting and how to do this. So 37 weeks of your pregnancy is when you are considered to be full term, and this is when it is recommended to begin, not any earlier than that, as long as you have the go-ahead from your provider as well. The risk would be the stimulation of the breast can cause contractions to begin and then ultimately starting labor, which would not be recommended before you are full term at 37 weeks. It is unlikely for this to happen because you are stimulating your breast for such a short amount of time each day with this method, but it is a known risk to be aware of and why collection shouldn't happen before 36 weeks, unless of course you are actively leaking and collecting in that way that we talked about. But actual stimulation should be held off until 37 weeks of pregnancy. And then before you get started, you will need small sterile syringes, and then it would be optional to have like a small plastic cup, like a medicine cup. You can express directly into the cup and then collect those drops with the syringe when you're finished, or collect the drops directly from the breast in the syringe. Either way works totally fine. I did also link the syringes I purchased for myself in the show notes at the bottom. It's a link from Amazon if you aren't sure which ones to buy. And now that you are ready to collect, I will go through a step-by-step explanation briefly, and then also link in the show notes a really good resource for you to follow as well. There is a link to a video on hand expression that you can visually see the technique if you're not really sure. You will then first start by washing your hands, finding a comfy spot where you can relax, and then even applying a warm compress for a few minutes to stimulate milk production can be helpful. This can also be collecting after taking a warm shower. This works just as well. You will then gently massage your breast in a circular motion to encourage that flow of milk. Once you are ready, you will do a C-shaped hold on your breast where you place your thumb and your fingers around your breast about an inch or two behind the nipple, forming that C shape. And then you would gently press your thumb and fingers towards your chest and then compress towards the nipple. And then you would release. And then you would repeat this rhythmically for several minutes, rotating the position of your fingers around the breast to express from different areas as well. So you'd continue for a few minutes, working your way up to gently expressing for about 5 to 10 minutes at a time, potentially 2 to 5 times per day. And then, like I mentioned, you can either hold a sterile syringe or container close to your nipple to catch those drops of colostrum as they appear. And then you would label the syringe when you are all done with the collection, and you'd write the date and time that you collected it, and then you'd place it in the freezer right away to make sure that it stays good until delivery, and all of those nutrients and antibodies are going to benefit baby when they are born. You might not get anything those first couple times or at all, so please be patient and try not to squeeze too hard. The volume will be very small, so doing this gradually over the next couple of weeks, multiple times per day, will hopefully provide you with some success. But again, we don't need that much to get a head start before the baby is here. And we might not even need any at all. But if it's something that you're interested in trying, I think it's worth a shot. And I know I only talked about hand expression here, and some people are wondering if they can use a breast pump for this. And truly you can do either, but I have seen much more success with hand expression due to the thicker consistency of the colostrum and honestly just how small the quantity is that you're expressing, that because it's such a small amount, the flanges from the breast pump just end up getting coated with the drops, and then it is really just difficult to collect, and then you end up wasting whatever you did collect. So I think hand expression is the way to go, honestly, with a syringe or into that medicine cup and then getting it from the medicine cup into the syringe. Thank you so much for tuning in to Your Birth Bestie podcast today. If you found this episode helpful on colostrum harvesting during pregnancy, I would love if you could take literally 2 seconds to rate or review the show. It is the best way to support this podcast and also help other moms find this information too. It would absolutely make my day if you could do that. And then coming up, I will be talking all about my preparation for my home birth in just a few weeks. So tune in for another episode next Tuesday. Bye, everyone.